This is an illustration of ultrasound-guided retrieval of a foreign body. The region we are examining today is the elbow. Conflicts of interest. I am a stockholder with Sonics Health, co-editor of a textbook on ultrasound for the orthopedic surgeon, and a faculty member for expert education. This case illustrates how ultrasound can be used to visualize soft tissue damage. In addition, it offers a virtual biplanar view without having to move the limb or an X-ray machine for localization of the foreign body and instrument guidance. Foreign body, as you know, is often an exercise in self-humiliation. Here are two X-ray views of the metallic foreign body in the proximal forearm. The patient is in his early 20s and is not forthcoming with details about how this occurred. Here is the external view. The lower injury is a third-degree skin injury, but without penetration. The middle wound is the entrance wound, and the ink marks proximally show the skin that is closest to the foreign body on ultrasound. On physical exam, the radial sensory, the superficial radial nerve, is out. The motor functions are all intact, although there is some pain on active use. Ultrasound was used to see what other damage was done and to see if it can be removed through a small separate incision. Here in the transverse plane, or short axis of the forearm, we can see that the foreign body is deeper than we had suspected based on the X-ray. The muscle on the top of the image is the brachioradialis, and there is a blood vessel crossing the foreign body. In this view, we are following the motor branch, or posterior interosseous nerve, from proximal to distal, and we can see that it is considerably deeper than the foreign body. We don't have a view through the foreign body because that would block the ultrasound. In the long axis of the forearm, we can also see the path of destruction indicated by the arrow. Note that the mixed gray pattern is very different compared to the organized muscle deep and superficial to that path. Here again we see blood vessels crossing, and we know that the metal must be somewhat smooth, as it does not reflect a lot of the ultrasound, as it is not directly perpendicular to the beam. Here is a comparison ultrasound of a total hip arthroplasty. The problem that this patient had is that the acetabular shell was set too far anterior and was not encased in bone. This created a problem with friction on the psoas tendon. Note that the smooth metal of the head and neck are seen only where they are perpendicular to the beam, whereas the acetabular shell on its backside is about 40 degrees to the beam, and we can even see some of the surface that is perpendicular, or actually parallel, to the beam. Here is another nice view of the blood vessels, the artery in the center and the two accompanying veins. And in Doppler we can see this even better. And we've decided to approach the foreign body through the wound rather than making a separate incision. We can align the foreign body and the entry wound, and this gives us a line on a purely arbitrary plane which is perpendicular to the probe or transducer. Then we toggle the transducer to visualize the path of destruction, and this gives us our orientation of the two planes without having to move the limb or the machine. We then guide the grasper up the path by bringing the grasper to the plane of the transducer. Parenthetically, set your machines so your video clips are more than 4 seconds. Unfortunately, these are 4 seconds. Grasp the object. Note how much more echogenic the object is when the grasper holds it perpendicular to the beam. It was easy to move this foreign body up the path and then to remove it from the skin. There was really no additional trauma in this operation. The object proved to be the back end of a 20-gauge shotgun shell, and again you can see that it is somewhat smooth metal. We can then check the wound for additional bleeding or debris and irrigate it from the deep surface out to flush out any material that might be in the wound. In summary then, a foreign body extraction can be assisted by ultrasound, as the ultrasound gives us a biplanar assessment and biplanar instrument guidance and makes easy what is usually an exercise in self-humiliation. Thank you for watching.